can I do to fix my neck? Is it simply a matter of losing weight? I'm not fat, but I could probably lose 10 to 15 pounds. Would this reduce my neck sag? I'm 35. I find myself elongating my neck and turning my head to a slight angle in all my pictures to eliminate this sag in pictures. I'm starting to become very self-conscious, whereas only 2 years ago, I had no concerns. An older friend of mine suggested hemorrhoid cream to tighten up the skin.
Thank you for your question. You're 35 years old, and although you're not fat, you do feel like you can lose 10 to 15 pounds, and that you are doing these various maneuvers to elongate your neck in order to hide some of the areas that you've shown in your photos under your chin and things that make you look certainly older. And your friend gave you this advice of using hemorrhoid cream. So let's explore this a little bit. You're 35 years old. That puts you in our practice in the area known as young, and which means that you are really not dealing with a facial aging issue specifically. A few years ago, I wrote a book called The Fine Art of Looking Younger. And genetically, there are certainly people who will have a little bit of fat under their chin. In our practice, we have done limited liposculpture on people who are athletes because no matter how much they work out, they have this problem area. But someone like yourself, if you feel that you have 10 to 15 pounds to lose, then my first line of advice would be is adopt a healthier lifestyle to the point where you can lose this 10 to 15 pounds. Incorporate athletic activities so that you can optimize your physical weight and the proportion of body fat. Once you've achieved this, you may still have a problem area, but it is always more straightforward to be able to sculpt a problem area in someone who is at least within a few pounds of their ideal body weight. I happen to also be boarded in body, breast, and extremity surgery, so I do a fair amount of liposculpture. And in my practice, I don't do liposculpture on obese people. I do liposculpture on people who are maximizing their fitness to the point where they plateau and they have limited areas. For example, for a woman, it would be in the bra roll area, or in the flank area, or the area adjacent to the hip. Or on men, it's the love handle area. So there is a lot to having facial, youthful appearance that is in the continuum of a healthy body. So I would always advise a lifestyle shift. You know, if you are 10 to 15 pounds overweight at 35, think about the trajectory you are on by the time you're 40 if you don't make any kind of change. So that's more of a holistic, general piece of medical advice for you, if that's helpful. So once you do that, I would suggest that you may want to consider some liposculpture to help define your jawline and maybe the under the chin area. Clearly, you're not ready for a facelift. As far as the advice about the hemorrhoid cream, don't think that's going to make a difference. So I think that that basically taking care of yourself and maybe doing some limited liposculpture will probably be the solution that will ultimately help you, to sum up my thoughts. So I wish you the best of luck. I hope that was helpful. Thank you for your question.